Have you ever had one of those conversations that just sticks with you? Well, I was talking with a friend this morning who's been dealing with a lot of chronic back pain, and it really reminded me how many people are simply trying to get through the day. I see it every morning at the gym. They're hurting when they wake up, they're hurting at work, they're hurting when they go to bed, and so often they're told the only options are pain medications, muscle relaxers, injections, or eventually surgery. I had a patient this week, same scenario. Now, don't get me wrong, there is absolutely a time and place for conventional medicine. But as a functional medicine practitioner, I always ask a different question. Why is the pain there in the first place? Pain isn't the problem. Pain is your body's alarm system. It's telling you that something underneath needs attention. It could be chronic inflammation. It could be nerve irritation. It could be mitochondrial dysfunction, nutritional deficiencies, poor sleep, hormone imbalance, autoimmune issues, or an injury maybe that never completely healed. If we only cover up the symptoms, we're often missing the opportunity to actually support healing. And that's where lifestyle really matters. This is the key component. Lifestyle factors matter. Nutrition is huge. The foods that we eat either fuel inflammation or help calm it. This is why I'm such a food Nazi. Focusing on whole foods, quality protein, colorful vegetables, healthy fats, proper hydration, and you got to reduce the processed foods and excess sugar. It can significantly reduce the inflammation burden in the body. Sleep is another one that's often overlooked. Your body repairs itself while you sleep. If you're only getting 4 or 5 hours of broken sleep every night, that's the key, broken sleep, it's much harder for your nervous system and tissues to recover. Movement matters too. That doesn't mean you have to go run a marathon. That does not mean pushing through the pain. Sometimes it's simply walking, stretching, mobility work, physical therapy, or strength training done correctly. Movement increases circulation, supports healing, and it helps reduce inflammation over time. And then we can look at targeted supplementation. Omega-3 fatty acids, magnesium, vitamin D when appropriate, curcumin, and other nutrients that may help support a healthy inflammatory response, depending on what your body needs. One of the therapies that I am most excited about right now is a regenerative peptide called ARA290. Have you heard of it? So ARA290 is a unique peptide because it isn't simply designed to mask pain. Early research suggests that it interacts with what's known as the innate repair receptor, a pathway involved in the body's natural repair processes. Researchers are exploring its potential to help calm neuroinflammation, support nerve health, and improve symptoms associated with neuropathic pain, a lot of neuropathy. That's a completely different way of thinking. Instead of simply trying to block pain signals, the goal is to support the body's own healing environment. So in my own clinical experience, I've seen some individuals with chronic back pain, nerve pain, tingling, burning sensations. You guys know these, I'm sure, if you're in it. And neuropathy, they report significant improvements after incorporating ARA290 as part of their comprehensive treatment plan. I've also seen some patients working closely with their healthcare provider, managing their medications, successfully reduce medications like gabapentin because their symptoms improved enough that the less medication was needed. Of course, everyone's situation is unique. I say this every day. There is no one size fits all. ARA290 isn't a cure, and no one should stop or reduce prescription medications without working with their healthcare professional who prescribed them. But I do believe it's exciting to see therapies that focus on supporting repair rather than simply covering up the symptoms. And ARA290 isn't the only peptide that I consider. I love all of them. You guys know that. I'm super passionate about peptides. Depending on the individual, I may also utilize peptides like BPC-157 to support soft tissue healing, TB-500 for recovery and tissue repair, or Cartilax, which is a bioregulator when we're focused on joint and cartilage health. Every protocol is individualized because every patient is different. That's really what functional medicine is all about. It's asking the why. Why is your body inflamed? Why are your nerves irritated? Why aren't you healing the way that you should? And then I build a personalized strategy using nutrition, lifestyle, targeted supplementation, hormone optimization when appropriate, and regenerative therapies designed to support your body's natural ability to heal. If you've been living with chronic pain, and I know so many of you do because you reach out to me every single day, do not lose hope. There are often more options than you've been told, and sometimes looking at the body as a whole can completely change your health journey. And if you'd like to take a deeper dive into your own health, I'm always here to help. At Life Wellness Forever, I don't just glance at a few lab values and tell you everything looks normal. I perform a comprehensive review of your biomarkers, blood chemistry analysis, and I'm looking for disease patterns. I'm looking for nutrient deficiencies, inflammation, underlying dysfunctions that may be contributing to pain, fatigue, or chronic illness. And together we'll develop a personalized plan designed to help you feel your best and address the root causes, not just the symptoms. Thanks so much for watching. If you found this helpful, be sure to follow along for more education on functional medicine, nutrition, longevity, and regenerative therapies. I'll see you next time, and feel free to share. Have a great day.